Today we're going to talk a little bit about how to go about with passing that NCLEX on the first try. I know a lot of times, we might be studying and we're thinking that we're going to probably be failing that exam just because, we're humans and we're always doubting ourselves. But I'm going to share with you some tips that will help with you understanding the concepts of your nursing exam as well as to pass on your first try. If you're new here, I'm Stacey, and I want to say welcome. Take the time out to go ahead and follow me. You can also follow me on TikTok at ThinkNursing and on YouTube at ThinkNursing. All right, so the first thing you want to do when you're thinking about, passing your NCLEX or your studying is to always have a plan. All right, and the plan is always going to be with you starting out with your foundation, knowing the foundation of what you are, getting ready for. Know the foundation of NCLEX exam. All right, the first thing you want to look at is the NCLEX format. All right. A lot of times you have high yielded questions that you definitely need to focus on. You need to also understand the different, short answers or select all that apply questions, the multiple choice question, prioritization, delegation questions, things like those. And you also need to learn about the computer adaptive testing system that they're using, know how it works. All right. Then you also can review the NCSBN. They have their different tips that you can always, look on and review the plan. And then from there, study accordingly. The second thing is to always create a plan, create a study plan, a smart one that works for you, something that will make you be consistent in your studies. So if it means that you're going to have a calendar where you write on it that on Mondays you study pathophysiology, Tuesday pharmacology, and so forth, then definitely go ahead and do that because you want to ensure that you put in the quality of work. It's not only about the time, but focus on quality, the amount of work that you cover on each day for different topics. The other thing is that you definitely want to go ahead and do some practice questions. If it means that you're going to select 75 to 100 questions and go about with studying them throughout the day, then that is something that you can think about. Go ahead and get some subscription or get some questions from like, UWorld, Archer. Those are NCLEX type questions, and go ahead and practice using those while you're studying. So the other thing is that you want to go ahead and focus on your weak area. A lot of times, we might have our weak area that every time we're fumbling through or we're having to review, certain information in order for it to stick. So if you know definitely you have that weak area, go ahead and schedule days specifically to focus on those areas. You're gonna prioritize high yield questions for the exam because a lot of times you will realize that the NCLEX is focused on pharmacology, lab values, safety, patient education, it's also about prioritization, delegation, infection control. So definitely go ahead and focus on those areas while you're studying. Do your practice questions to see how the questions are structured. And then from there, at least you'll be a little bit more comfortable with answering these questions. Then the other thing is when you're taking your exam, you always want it to be a case where you're thinking like a nurse. So practice from start that you're taking this exam as a nurse. All right. So go ahead, think as a nurse and do the exam as a nurse. So pretend as if you are the nurse at the bedside of these patients that you're answering in the questions. And then from there, you delegate, you prioritize, you think about the patient first and move on. All right. So you're always going to ask yourself what keeps the patient safe? What are going to be, the things you will do right now? Do not overthink the question. Do not add anything to the question. For each select all that apply question that you have, go and ask yourself each option that you have, the answer that you have, is this a true or a false question? And then from there, you'll be able to answer the question appropriately. So a lot of us tend to have problems with managing stress. And, we know that the NCLEX exam or throughout nursing school, it can be very stressful at times. And so I want us to go ahead and start managing our stress from day one. So when we start, getting closer to the exam, we're not feeling too stressed out. So you're going to use affirmations daily to tell yourself you can do it. This is what you are made for. You will get through. You will pass the exam. Tell yourself, all of these affirmations. You are ready for this exam. I am ready to pass. I will pass. Talk to yourself and tell yourself daily that this is what you are going to be doing. The other thing is that you definitely want to make sure that you're prioritizing your rest and your sleep. Those are very, very important. If you're not sleeping well, it's going to affect you, not necessarily only for the NCLEX exam, but in the latter part of your years. All right. And the one thing that we definitely want to try to do is avoid burnout. Burnout doesn't have to be you working, in a job for years. It can be you studying and not taking any break prior to you doing your NCLEX. And so you might find out that you will have burnout before your exam. So go about with studying and taking your small breaks in between. If it means that you're going to study for 1 hour and try to get every 30 minutes a little 10 minutes break, things like that will make you feel a bit more comfortable, as well as make you cover more topics, because you're not going to feel exhausted, or you're not going to feel overwhelmed by the content that you're covering. The other thing that I would encourage is for you to go ahead and do a mock NCLEX. It doesn't have to be anything where you have to go into one of those, centers to get a test done where you're using the computer system. No, you can go ahead, get your own questions, sit in a quiet room, no cell phone, no distractions. Go ahead, time yourself and do your exam. See how well you do in terms of the questions. Look at your areas that are, the strongest, and then you can focus on the weak area, and then from there, prepare yourself adequately based on the exam that you've just done to test yourself prior to doing the NCLEX. So the day before exam, I want to encourage persons, do not cram. If you never get it, you just never get it. All right. So do not cram. Just go ahead and revise, small notes. You have your mnemonics, prioritization tips. You also have flashcards that you can use. Go ahead and use those. Nothing that is going to be too much for you or feel too heavy or overwhelming for you prior to the exam. All right. And the other thing is definitely go ahead and eat. Eat well, hydrate yourself, relax, find something to relax, relax yourself throughout the day and things like those. And then from there, you'll go in and sit your exam. Do not be there trying to get in the last information on the exam and show up late. All right. Try to eat something light for your exam. Rest before coming in for your exam, hydrate before coming into your exam, and do not panic. You understand? Do not panic because it's a question that you probably don't know. Just tell yourself that you were trained for this, trust your intuition, and just go with your gut feeling a lot of times. All right. And then from there, hopefully you will do well on the exam. Most important thing is to stay calm. Stay calm, arrive early, and do well on the exam. I do hope that these tips will help you to, prepare you for your exam, and hopefully you'll be able to pass on your first try using these tips that you will use throughout your study period. If so, go ahead and give the video a thumbs up if you do enjoy the content. Remember to go ahead and subscribe to my page here at YouTube at Think Nursing, and follow me on TikTok at Think Nursing, where I share content related to nursing, travel, and lifestyle. Until then, I want to say thank you so much for watching, and remember to go ahead and check out the other videos on the page. Until then, bye.